Welcome back. Thank you for staying with us. In case you're just joining in, we are having a conversation on cervical cancer, as January is Cervical Cancer Awareness Month. Now, before we took that break, Doc, Pamela actually touched on what treatment she went through, and she mentioned hysterectomy. For purposes of those who don't understand that medical language, what does that mean? What surgery is that?
For your question, hysterectomy, removal of the uterus.
Okay.
It is a procedure that is done because of one reason or another when the uterus has a problem that can be solved by surgery, ranging from fibroid, cancer, amongst others. And in relation to what she has described, hysterectomy is just one of the treatment modalities for cervical cancer. I don't want the viewers to have concluded that the only management option is hysterectomy.
Yeah, because I actually had a follow-up question on that. So for someone who's still very young, they haven't had any children yet, is there a substitute to the hysterectomy?
Yes, there is a substitute to hysterectomy, and this is based on the stage of the disease. If the disease is amenable to surgery, remember, not all of them are amenable to surgery because of one stage, because of the advanced stage. But if the disease is amenable to surgery, you can actually remove the cervix alone and leave the body of the uterus in place. This procedure in medicine is called trachelectomy. But you know, once you remove the cervix, which I already mentioned earlier is the neck of the uterus, it means that the uterus is compromised in terms of carrying a pregnancy. So when you do this procedure, we call it trachelectomy, removal of the cervix for the women of reproductive age and they still desire fertility. You have to put a kind of a purse string where the cervix was, so that they are able to carry on with their pregnancies when and should they desire to have. I may take a step back a bit because in those patients with pre-malignant, pre-cancer, they don't necessarily have to go through hysterectomy. I said you can excise or cut off that part of the cervix that has the disease. And those that have more advanced disease, then you choose one modality of treatment. Because as gynecologic oncologists, we're here to offer also the advice how to manage these patients. In that not all patients will benefit from surgery, more so if the disease is advanced. Therefore, you choose one modality of treatment, because if you give both surgery and then offer another treatment, the side effects are much more in terms of the side effects to the bowel, to the urinary system. So it's important for us to give proper advice on treatment in accordance with the stage that the patients present in.
Yeah, so the treatment is determined by the stage that the disease may be at. So what are the stages, if you may just take us through that, the stages of cervical cancer and maybe the treatments for it? Yeah, for each stage.
I don't want to sound like I'm in a medical school lecture,
try and make it
but I'll try to break it down. The staging is mainly in 4 stages, whereby stage 1 is the disease is localized to the cervix. This is further broken down into 1A and 1B. 1A is, we call it microscopic disease. You don't see it with the naked eye. But if you do a biopsy means you take a small tissue for examination, then the pathologist is able to look at it in under a microscope and will be able to tell you this is stage 1A because it is, you can't see it with the naked eye. Stage 1B, you can, when you examine, you see the changes on the cervix, an obvious tumor on the cervix, and you kind of determine the size based on in centimeters. So at the risk of sounding like I'm in a medical school, we have got 1B1, 1B2, and 1B3, depending on the size of the tumor that you see. So let me just dispense with the treatment of these two stages. So stage 1A, depending on the fertility desires, you can remove just the cervix. Those who don't desire fertility, you can actually do a hysterectomy. Stage 1B, almost the same, but the surgery of stage 1B is a little bit more complex than stage 1A in that you remove the supports of the uterus. You try and remove the entire tumor. Remember, the disease also spreads, and it spreads to what we call the lymph nodes. So in such a stage, you're also expected to remove the lymph nodes because it will help you also do the staging, also determine treatment. But when one starts seeing stage 3, then management is practically, we prefer one modality of management, which is chemotherapy and radiation. And in this case, chemotherapy is given maybe once a week, and the radiation for a consecutive 5 days, up to we call it up to 25 fractions of radiation. And remember, most of sometimes you see women who indicate that they have gone through radiation. But when you dig deeper into the history, you find that they did not receive the optimal treatment, because the radiation is in two forms. There's what we call external beam radiation, which kind of addresses the path of spread of disease. And then you should also undergo what we call intracavitary radiation. Means the radiation has to be introduced to very near to where the tumor is, also known as brachytherapy. So there must be a combination between external beam radiation, because women feel better after that. The bleeding stops, the discharge stops, and then there is kind of this false sense that you are cured, but treatment must be completed. In that, after external beam radiation, one must also undergo what I'm calling intracavitary or brachytherapy to bring the radiation very close to where the tumor is. Then, of course, we must understand that patients transition from one stage and also to what we call prolonged care and palliative care. We must also strengthen our palliative care in this country. We know we have made great efforts and strides towards palliative care, because we know that at some point we will need palliative care, and this should start much earlier, and the discussion should start earlier regarding the palliative care towards the end.
Well, Pamela, back to you. Just how costly was the treatment?
Thank you. When you start the treatment from screening, there are several tests that you have to undergo, and most of those tests are costly, and mostly the insurance cover doesn't cover that. So you have to dig that from your own pocket. So that is where it becomes costly. But for my case, I really thank the NHIF. It paid like for all my surgery.
Really?
So there, I really count myself lucky there, and I really thank the insurance scheme. But one thing I'm really calling upon them is that may they please take the cover to cover the stages of now the testings, because after screening we lose very many women because they cannot afford to pay for the biopsy and the CT scans, because you really need to go through very many tests which are costly, and unfortunately NHIF doesn't cover all that, and so these women drop out on the way. And as a survivor, we are on the ground and we meet with these women, and they are like, I can't continue with the treatment because I don't have the money. So it makes the testing also useless, because what is the need for a woman to test or to do pap smear or the screening that found out to be they test positive for cervical cancer, but they cannot continue with the treatment just because they do have money. And that is where now you get this thing that people say in Kenya, better something that you don't know will not kill you. So I think that really kills the idea of going for screening and testing. And that is why as survivors, we are really advocating and for the creating awareness for cervical cancer. Women should go for screening. And if the elderly ones, they have to go for pap smear. But now the question we are asked on the ground is that what if I'm found out to be having cervical cancer and the cost is too much and I don't have the money to treat? Yeah, so we are appealing to the government to look for a package, and I think the new scheme, the HIF, will have that on their cover, so that the treatment for cervical cancer will not just start from when one has been hospitalized, but it will come in from the screening to the tests, the biopsy, and all the other tests for CT scans and imaging that are needed for it, so that we don't lose women on the way for lack of funds for the treatment.
Yeah, we really hope that that will be looked into. Still on you, just how would you say the cancer affected your life generally before you got healed from it?
One was emotional. The feeling and the fear that you have that now I have cancer, I'll lose my life. Another one, the stigma. I remember there's a time I came out in a crowd and I said that I had cervical cancer. One of my very close friends came and told me, why did you stand and say that you had cancer? So we really fight stigma. And I think that is what made me come out now, because I'm like, how many other women fighting stigma behind there, not coming out in the light, telling people about this cancer. And as the Bible says, my people suffer for lack of knowledge. It's true that very many women out there don't have the knowledge for cervical cancer. And also, I think because it's something that which is under the belt, it's not something that very many women like to discuss openly about it. And so I come out, I tell them, cervical cancer is a disease like any other disease, which can be treated and cured. So we don't have to feel shy about it. We don't have to fear. It's not a curse. It's not witchcraft. It's a disease that can get any other person. It doesn't have class. It doesn't know class. So every woman can get cervical cancer. So we just have to come out in groups and voice our voices about it. And that made me join a group of survivors under the Kilele Health Association. Yeah, we are very many women that came up, and what we do is voicing up our voices, speaking about cervical cancer. And to me, what I normally tell the women, cervical cancer, I think, is one of the best cancers. Why do I say so? With the HPV vaccine given to our girls, we prevent them from having cervical cancer in the future. And with the screening like I did, screening saved my life, because I'm like, if I didn't go for the screening, maybe I could have waited then for the signs. And maybe the signs, because differently, they come, I think, concerning an individual, they come up during at any time, and maybe they could have come at stage 4, which could have been the treatment is harsh. Second, it's costly. Like my case, after doing the surgery, I didn't have any need to spend more money, except from the annual checkups, because I go for pap smear once annually. And yeah, that is, you can admit that is reasonable. I don't spend so much on that. And I live full life, a healthy life.
Cancer-free.
Cancer-free. I've been to Mount Kenya thrice now after my cancer. I've summited all. 2023, a group of survivors, 3 of us, we went to Mount Kilimanjaro with the Kilele Health Association and some other Rotarians who are supporting us. We went to Mount Kilimanjaro fundraising funds for women who have been early diagnosed with cervical cancer so that at least they can get some cash for their treatment, and we're able to pay for the NHIF. So I live a normal life. I tell people it's like, at times when it's the scar, oh, so I had cancer at one time, but I rarely think of cancer.
Yeah.
I rarely think of having cancer.
And it's good to know that you're not living your life to the fullest. Doc, Pamela mentioned that cervical cancer is one of the best cancers. I don't know how you'd argue that, but I get her point of view because it can be prevented. There's the vaccine. And earlier on, I'd mentioned that I'd ask you how much does it cost to get the vaccine?
Yeah, I don't know that to say it's one of the best cancers because the diagnosis of cancer itself is devastating.
Yeah.
But it fits the World Health Organization pattern of diseases that can be prevented and eradicated.
Yes.
Because one, it has a very long latent phase in that up to 10 or 15 years for you to do something about it. Secondly, you have an identified causative agent, which is HPV, so you can also target that.
Yeah.
And coming to your question on the cost of HPV, the Ministry of Health has rolled out a vaccination program. It is free for young girls. It is free.
Until what age?
Currently, the recommendation of the administration of the vaccine that is being administered is between 9 to 15 years. That is the recommendation of that vaccine, because we are using one that covers 4 types of HPV. Allow me to mention them: 611, which causes the genital warts, and 16 and 18 responsible for the cervical cancer. So the Ministry of Health has rolled out the program that is free. In the private sector, I may not have the amount that it costs to have the vaccine in the private sector.
Okay, so for young girls between the ages of 9 to 15, it's completely free.
Yes.
Yes, and you'd advise parents to take their children for that vaccine?
Yes, that's our advice. That's our advice, despite all the vaccine hesitancy. We have established from the research that's been done that the vaccine is safe, and so it can be administered to the young girls.
Okay, but that does not mean that only them can get it. Even a lady my age, I can take it upon myself to go get the vaccine?
Yes. Because you've asked the question, let me break it down further. Yeah, we have different kinds of vaccine. The earlier one was called the Cervical. Cervical covers against 2 HPV. And then we have what we call the Gardasil against the 4, which is being used in our public health facilities, and that has been approved from 9 to 26 years actually. But the FDA has approved the use of vaccines up to 45 years of age.
Okay.
The fact that it's recommended to be given in younger girls is because you want to administer before they get exposed, which means that the antibody response, because what you're trying to produce is antibodies. And let me also correct, we are not actually inoculating the recipients with a virus, with a live virus. Actually, they're being inoculated with viral-like particles, such that the body produces antibodies against the human papilloma virus. Okay. The younger the subject, the younger the recipient, the more the antibodies produced. We call it we measure the antibodies in terms of the titers. We call it geometric mean titers. The younger population produce very high levels, so the geometric mean titers are very high. But as your age advances, then the titers get lower. So it still gives some level of protection against the high-risk types of HPV. It's been also shown that the vaccine can slow down the progression of the pre-malignant phase to the malignant phase. That's pre-cancer to cancer.
All right, thank you for just getting that clear. There has been speculations on contraceptives and that some of them may cause cervical cancer. So is there a correlation between cervical cancer and some contraceptives or contraceptive use?
I hope that you will not ask me that question on air.
Well, I had to.
Yeah, of course, there has been some data suggestive that the contraception may predispose to cervical cancer, which has been used to kind of claw back the gains that we have made with regards to our prevention of cervical cancer and also birth control for those who desire to use it. There is no conclusive evidence that contraception leads to cervical cancer. We know that contraception has many other benefits. There has been also proponents that maybe those who are on contraception are more exposed to HPV, which is also subject to debate because contraception is not necessarily does not make one to have multiple partners. Remember, one of the risk factors of acquiring HPV is multiple partners, increased sexual activity, amongst others. Yeah. So those are just associations that don't have a lot of scientific basis. Okay. And you'll leave it at that? I think I'll leave it at that.
Okay, Pamela, how long have you been cancer-free? How many years now?
I did my surgery in 2019. That was on March 29th. And after that, the piece that was removed was done biopsy, and from then I was told I'm cancer-free. So ever since, I've been going for the annual checkups and still nothing.
So you expected to be going for annual checkups for the rest of your life? Or is there a time frame? Because I think I read somewhere that after healing from cancer, you still need to be going for these checkups for at least 5 years for them to completely decide that, okay, now you are cancer-free.
I think to me, as per my brains, I'll always do it annually. I don't want to take any risks away from it.
Doc, what causes the recurring of cancer? And as I've said, I read that you need, after being cancer-free, you need to go for checkups yearly for 5 good years for you to be completely, safe.
Yes. After cancer treatment, we have an algorithm for cancer care in that one has to be checked every 3 months for 2 years, then every 6 months for the next 3 years, then annually for life. There are risk factors that predispose to recurrence. Now to come to your question. One was the stage of disease. The higher the stage, the more the risk of recurrence. Why do I say this? Mainly because if you are doing surgery, especially for surgery, you want to get the whole tumor out. And sometimes you are not able to get very good margins. Margins means the distance from the tumor to the normal tissue, because the tumor was rather big. So if you have got very close margins after surgery, then the risk of recurrence also increases. How big was the tumor? And if the lymph nodes, remember I mentioned about the lymph nodes, if the lymph nodes are involved, those are some of the risk factors that predispose one to recurrence of disease. Okay.
All right, I'd love to get your parting shot, Pamela, as we finish. I want you to talk to someone who's just been diagnosed with cervical cancer. Yeah, as we finish.
Yes, thank you. I'd like to tell anyone that has been diagnosed with cervical cancer that cancer is not a death sentence. they can see me. I survived cancer through treatment, so please embrace the treatment, go on with the treatment, follow what the doctor advises you to do, whichever treatment, be it surgery, be it chemo and radio and brachy, everything, and you shall come out victorious. And please, to the government, as survivors, we please urge them to invite us when they're making the policies in the NHIF scheme, so that they could get the real needs of the patients on the ground and know how to help us. Thank you.
Thank you so much, Pamela, and thank you so much, Dr. Elly, for coming on to this show and helping us with this particular conversation on cervical cancer. If anything else, I hope that you have taken one thing, or rather, if nothing else, I hope that you have taken one thing, and that is go for screening. That is what I come out of this conversation with. Let us all take it up upon ourselves to go for screening. Every lady, just, you know, I heard that you should give yourself a birthday present every single year, and the birthday present should be you going for that pap smear, or you going for screening of cervical cancer. This is where we call it a wrap today on Good Morning Kenya. Thank you so much for tuning in. On behalf of everyone who has made this show a success, we want to wish you a lovely day. Do enjoy the rest of your viewing. Goodbye.